Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about a debilitating skin condition. Psoriasis and the immune system, more confusing than teenage slang. The immune system is one of the most complicated systems, as challenging to understand as the human brain, the economy, and teenage slang. When a complicated and interconnected system gets out of whack, terrible things can occur. Autoimmune disorders, mental problems, supply chain problems, and skibbity toilet. One particularly uncool immune condition is the skin disorder psoriasis. Psoriasis is a chronic inflammatory autoimmune disease with no cure. It affects approximately 2 to 3% of Americans, though precise data on its prevalence are limited. White Americans are at the highest risk, though there may be underreporting of cases among those with darker skin. Onset, much like our inability to keep up with cool lingo, usually occurs before age 40. The word psoriasis is from the Greek word psora, meaning itch, a common symptom. Other symptoms include red, hardened, flaky, or peeling skin. There are a few manifestations of psoriasis, but the most common variant is plaque psoriasis, with thick, shiny scales that are silvered, pink, red, or purple. Psoriasis can be a major bummer for sufferers, and it can be disabling, disfiguring, and lead to low self-esteem and depression. Psoriasis sufferers have increased rates of arthritis, eye problems, inflammatory bowel disease, cardiovascular and metabolic diseases, including high blood pressure, diabetes, high cholesterol, and stroke. Inside the body, psoriasis is a complicated immune disorder with genetic and environmental risk factors. T helper immune cells become stimulated and release signaling molecules called interleukins, which are then mediated by enzymes like tyrosine kinase 2. The outer layer of the skin is made primarily of keratinocytes. Tyrosine kinase 2 and the interleukins tell the body to produce too many skin cells, which form the plaques characteristic of psoriasis. The end result is an immune response called inflammation and new cell growth on the skin to help fight an imagined threat. The chronic nature of psoriasis is due to keratinocytes producing molecules that activate those T helper immune cells, making for a vicious cycle. Treating psoriasis is a real challenge. Obesity, smoking, stress, and infections can trigger psoriasis onset, exacerbate flare-ups, or contribute to its progression to long-lasting chronic psoriasis. Targeting these factors may help reduce risk and severity. Mild to moderate psoriasis can be treated using topical or light-based approaches. Topical creams, ointments, or lotions may contain corticosteroids, vitamin D or synthetic vitamin D, or medications that promote the shedding of dead skin cells called keratolytics. Light-based treatments called phototherapy are the strategic exposure of the skin to UV light, which slows the body's production of skin cells. For moderate to severe psoriasis, UV light therapy may be combined with light-sensitizing medications, but long-term use comes with the risk of skin cancer. Current medical treatments for moderate to severe psoriasis are systemic. They affect the whole body. Biologics are complex drugs that can target specific systems in the body, including the immune system. These target the cytokines or other systems on the path of immune response and attempt to disrupt them. Targeting the immune system directly is a tricky balancing act, which can increase the chances of infections, blood disorders, and some types of cancer. Clinical trials have found great effectiveness of biologic medication with up to 80% success rates, though side effects must be monitored carefully. New medications which target the psoriasis pathway with fewer effects on the greater immune system are being developed currently and may be available in clinical trials. Now that's what I call Riz, Lit, and Fam. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.